New draft guidelines issued by the Centers for Disease Control and Prevention, CDC, on Monday suggest that physicians might consider prescribing doxycycline, a potent antibiotic, to certain patients to hinder the propagation of sexually transmitted infections, STIs. This strategy, referred to as doxycycline post-exposure prophylaxis, DoxyPEP, holds promise as a significant shift in the battle against the persistent STI epidemic in the United States. This proposition follows preliminary research indicating that early administration of doxycycline post-potential exposure can help avert bacterial infections, contrary to the current practice of prescribing the antibiotic post-diagnosis. Dr. Jonathan Mermin, a senior official at the CDC, expressed optimism about DoxyPEP's potential impact, anticipating that its widespread adoption could prevent tens of thousands of infections. The CDC is currently inviting feedback on these draft recommendations, and following a review of comments, a finalized version is expected to be released early next year. At present, the proposal to use DoxyPEP is specifically targeted towards groups most afflicted by the STI crisis, including men who have sex with men and transgender women, particularly those with a recent history of bacterial STIs. The protocol advises a 200 mg dose of doxycycline within 72 hours post-sexual activity for those deemed most likely to benefit from the drug. Despite this, the CDC is withholding a broader recommendation until more comprehensive data is available. A trial involving cisgender women did not show conclusive benefits, leading officials to call for further study before broadening the recommendation. The rollout of DoxyPEP is already in progress in several health departments and sexual health clinics. Advocates in the field, like David Harvey of the National Coalition of STD Directors, note the significance of this development and emphasize the affordability of doxycycline compared to other medications. Anticipating the official recommendation from the CDC, many agencies are eager to adopt this preventive measure. However, concerns regarding the potential risk of antibiotic resistance with widespread DoxyPEP usage have been raised. The CDC plans to monitor real-world application and resistance patterns diligently, acknowledging the vital role of long-term oversight and further research in refining the guidelines and addressing outstanding questions about potential risks. While the CDC's new draft guidelines on the use of doxycycline, DoxyPEP, post-exposure show significant promise in the battle against STIs, it's crucial to approach this potential new preventive measure with care. The CDC continues to invite feedback and emphasizes the importance of additional research, long-term monitoring, and evaluation to ensure the method's effectiveness and safety. As the scientific community awaits a final decision, the critical balance between the potential benefits and the risks, such as antibiotic resistance, underlines the importance of ongoing investigation and scrutiny in the fight against the persistent STI epidemic. Thanks for watching. Be sure to like, subscribe, or follow us for more on this health channel. Until we meet again, ciao.